back. I'm Dr. Serrano. I'm one of the doctors here at Ignite, and for me, this is my favorite visit because this is the visit where we get to share with you the heart behind the practice and how we get the amazing results that we see with our patients. I know it's a little unique, being in a doctor's office, watching a video, but we do this for a couple of reasons. The main reasons for me is really because of my story. When I was growing up, I was one of those kids that was constantly sick, always on medication, in and out of the hospitals constantly. And one of the things that I really disliked about that was the fact that you would go to the doctor's office, they would look at you for 2 to 5 minutes, and the next thing you know, you're walking out with what? A prescription. The thing that I didn't like about that was that there was never any empowerment, there was never education there was never telling my parents, hey, this is what's going on and let's find some causes. And we call that in this office the doctor-patient relationship, which means we're the doctors, you're the patient, you're gonna come into the office and I'm just gonna tell you what to do. Take it or leave it. That is the last type of relationship that we wanted with our patients. What we want from day one is what we call the doctor-doctor relationship, which means at the end of the day, it's your health, it's your body. You should be educated, given all of your options so you can make the best decision when it comes to your health. So the reason I ended up like that is because nobody ever gave us answers. It was always treating symptoms, it was covering up problems, never getting to the actual root causes and the solutions to correct the problems. And that's what we're gonna do in this office. We're never gonna cover up symptoms. We're always gonna dig deep until we find the root causes. And that's what we're gonna help you treat. So how do we do that? We do that by figuring out what true health is. So what is it? What is health? If you were standing in front of me and I was to ask you what health is, what would you say? Most people tell me that health is how I feel. If I feel good, I think I'm healthy. Unfortunately, this is the worst barometer we can go by, but this is what most people go by, and I get it. I understand why we do this, because this is what we're taught by our system, right? Any commercial you see, any magazine that you open, when you see a list of symptoms or pains or aches or problems, guess what they're telling you? Take a pill, take a lotion, take a potion. They're always treating symptoms, never treating causes. While those things might make you feel better, at no point me taking a pill, a medication, actually builds health in my body. So how do we build health? We have to understand what health truly is. Think about all chronic diseases out there. When do you feel a symptom? You feel a symptom when you've already had the disease for years and years and years. Think about heart disease and cancer. Heart disease and cancer grows inside somebody and breaks your body down for years before you have a symptom. Most people who have a heart attack, they actually felt great the day before the heart attack. So as you can see, we can't just go by how we feel. We have to go by a different gauge, a different barometer, and for us, it's really simple. All you have to do is go by the actual definition of the word. Like Google health, and let's go by that. So when you do that, you're gonna get a lot of different answers, but all of the definitions and answers to health always have one thing in common. And the one thing that it has in common is that it'll say somewhere in the definition that health equals function. If my body's functioning at 100%, that is ultimate health in the body. If I'm on the other side of the spectrum, at 0%, that is, we're not here, we're dead. And every single one of us is somewhere on that health line. Every decision that we make either drives us towards better health, better healing, better function, or moves us towards sickness, disease, and early death. But the one thing that nobody ever teaches us is where does health, where does function in your body, where does that start? Where does that come from? And that's what we're going to talk about here. What controls everything in your body? What controls all healing and all function in your body? You guessed it, it's the brain. The brain controls everything. For your heart to beat, lungs to breathe, for your stomach to digest food, the brain has to send messages down the spine, out through the nerves. Now, I've been a chiropractor long enough now, and I've heard it all. I've heard people that say that they don't believe in chiropractors. I've heard people say that we're quacks. I just want to be really clear. This right here, this is not chiropractic. This is just anatomy and physiology 101. So if I was to go into your spine and find the nerves that go to your heart, and I cut those nerves, what happens to the heart? Yeah, it dies. You stop functioning. So obviously you don't have cut nerves, you wouldn't be here. But what we see all the time is that it's not that there's cut nerves, but what if I went into somebody's body or into your body and I put pressure on the nerves going to the heart immediately? What starts to happen to the heart? Yes, it starts to dysfunction. it starts to decrease how it's working. And as soon as you start to decrease how it's working, it starts to produce dysfunction, disease, and early death. And that is the disease process most people don't talk about. Most doctors just talk about the disease process when it's already in the end stages. They never look at what caused this to begin with. And that's what we're going to do in this office. So what does that look like? Well, in the model, from the back or from the front, if I'm looking at your posture or if we took an x-ray, we want the spine to be nice and straight. If I take the model here, these are the bones, these yellow things here are the nerves, and if I took an x-ray and if there's twisting or bending to the spine, what happens to those nerves? Yeah, there's pressure. If there's pressure on that nerve, even if you have no pain, if there's pressure on that nerve and that nerve's going to your heart or to your lungs or to your immune system, is there any possible way that your body is functioning at 100%? The answer is no. So from the back, it's pretty easy. We just want a nice straight spine. From the side, you actually want curves. There's a neck curve, a mid-back, and lower back curve. Those curves should be at 45 degrees. But there is one curve that's more important than others, and it's called the arc of life. It's also called your neck curve, your cervical curve. Why is that the most important curve? Because it's closest to your brain. Every single message has to go through this curve before it gets to any other part of your body. So let me show you what this looks like on an actual x-ray. What does all of this actually look like on an x-ray? And the reason we're going to be going over this is because of what I said at the beginning. You know, I want you to be your own doctor. I want you to be empowered. So I want to go over some x-rays here so that when you see your x-rays, you know exactly what you're looking at and you know exactly how to correct the problem. So on the neck, I mentioned the arc of life. This is what it should look like. I keep it simple. I just call it a banana. If you have a banana, that's a good thing. If you have no banana, not a good thing. So this is an actual x-ray. If I was to cut the spine in half, this is what you would see. You have the brain here, you have the brain stem that sits here, and then you have the spinal cord that fits in there like a puzzle piece. Why is this so critical? Well, this part right here, the brain stem, that is right under this first bone in your spine. It's the most critical part of your spinal cord because the brain stem, if you don't know this, it controls everything you're not thinking about. Your blood pressure, major blood pressure centers right there. The neurotransmitters that help you focus for kids in school, the neurotransmitter that help you fall asleep at night, the things that help with depression, anxiety, that keep everything in balance, all of that happens right there in the brainstem. So you can imagine, if I start to move this bone, this is the C1, also known as the atlas bone, if I start to move this atlas bone, as I start to put pressure on the brainstem, can you see how I am already affecting the way the body's functioning? Absolutely. So let me show you what that looks like. This is a phase 1. This is typically what we see. So phase 1 is when the spine is out of position. You've lost the banana. So literally, you have a curve in your neck and you're starting to lose that curve in your neck. By the way, why does this happen? Why is this so common? The most common things that we see is one, yes, it can happen from a auto accident, some type of slip or fall where you have that whiplash effect. But the most common thing that we see is this here. What are we doing? That is looking down at our cell phone. That is called text neck. It also happens when we're on computers or we're sitting watching TV. You start to lose the curve in the neck. You know, when I started practicing years ago, I would rarely see any kids with this text neck. Now, if I was to look at a teenager or take an x-ray of a teenager, it is 75 up to 85% of the teenagers already have text necks, or even worse, it's literally going the other direction like this. So what makes a phase 1 misalignment? Phase 1 means that the bones are out of position, but there's no degeneration to the spine. These are the bones here. These are the spaces between the bones, and those spaces are well maintained. Those are your disc spaces. If you look inside though, you can look at this top area here. This atlas bone has shifted up and you're already putting a massive amount of pressure on the brainstem. So you can see the body's already being affected. So what happens here is one of two things. Either A, you're not having any symptoms yet and you don't know this is happening, or B, you're already having symptoms and covering those up with medications and this just continues to progress. And that's when the phase 2 misalignment comes in. So in phase 2, the only difference between phase 1 and phase 2 is that there are bones that have started to degenerate. There are bones that are starting to decay in your spine. And you can see those here. You see the healthy bones here with spacing, and you see these bottom bones where their space between the bones is starting to get compressed, looks kind of mush, like a mush sandwich. This is spinal degeneration. This means that those bones are starting to degenerate and decay, and when this starts to happen in your body, specifically in your spine, it is progressive. It does not stop until you do something about that. What do I mean by that? You have to take pressure off of that area for you to start to heal that area. Now, one of the things that we can't do in this office is I can't take this bone and reshape it back to normal. So what we can do is we can take pressure off of these areas so that the degeneration stops, and we take pressure off the nerves so your body starts to function and heal better. So what typically happens is that we have these issues going on, nobody teaches us this, and we just start to cover up the symptoms, the problems with medications. Let me pause for a second and let you know that I'm not against medication. What I'm against is using medication to cover up symptoms. See, if my blood pressure went up to 300, you take me to the nearest hospital, you save my life, you give me blood pressure medications, but then once you give me the blood pressure medication, let's ask why. Why did my blood pressure go up to 300? Was I not eating right? Was I not exercising? Were there areas of the spine, like my brainstem, that were getting crushed and compressed by the atlas that we know causes blood pressure issues? See, give me the blood pressure medication, then let's ask why so that we can get to the causes and not just cover up the symptoms. So what we see happen is that we continue to cover up symptoms, and then this leads to phase 3. Phase 3 misalignments, I don't see a lot of patients with this because this is the point where all of the bones start to degenerate. Why don't I see a lot of phase 3 misalignments in my office? Yes, these people do die, they perish, but if they were alive, they're not in our office because typically they're in nursing homes, they're in hospitals, they're in wheelchairs. So that's why we don't see them in our office. So what is phase 3 and why is this so critical? Well, think about what we said at the beginning. For your body to heal and function, the brain has to send messages down the spine out through the nerves. In a phase 3, the bones are degenerating and they're literally crushing the spinal cord. On average, if somebody's in a nursing home, they're on 18 to 22 medications. What does that mean? That doesn't mean they're just sick. That means their body's not functioning. That's why they're on that many medications. So our job from day one is to help the body start to heal, to function better. And we do that by removing the interference from your nervous system so you can immediately start to function better. So this is Jessica. She's 22 years old when I first met her. And the only reason she got to our office was because of her friend and a patient of ours that we call Crazy Amy. Crazy Amy was at Jessica's house, and Jessica had just come back from her doctor's appointment, and she was told the things that she was dealing with, she was just going to have to deal with until they got bad enough to get put on more medications and eventually surgeries. She was dealing with migraines that were so severe that her husband would have to dress her in the mornings at times. She would spend days in her bedroom. She literally had to quit her job from the migraines. She also had neck pain with numbness going down into her hands. And she had just come back from her last doctor's appointment, which was her 4th doctor. It was a neurologist and a spinal surgeon. And he had told her that she can get migraine medications to ease the migraines. She can just stay on those. And then she can get injections in her neck to relieve the neck pain and potentially help with the numbness. But then when it got bad enough that the next phase or the next stage or step was just a surgery in the neck to help her with the symptoms. Amy was sitting there listening to her and said, "This is crazy. You're going to my chiropractor." Literally, she dragged her in that day. She didn't have an appointment. She walked into our office and she says, "Will you see my friend?" And I said, "Absolutely, of course." We took her back and this was her x-ray. When Jessica saw her x-ray, she immediately knew this is where the causes were. This is what's causing my issues. And she asked me a question, and this is why I share her story. She said, "How long will it take for my migraines and my pain to go away?" And I wish I could sit here and tell you that all your migraines gonna go away, all your pain's gonna go away. And my answer to her was this: Unfortunately, I can't tell you that your migraines are going to go away. I can't say how long it's going to take for them to go away. But what I can say is that if we correct this, if we start to get a better curve in your neck, you're going to give yourself the best chance for those migraines to go away, for the best chance for the numbness and the neck pain to go away. She said, okay, I'm all in. So she started care in the office, and this is her x-ray a few months later. Obviously, you can see a big difference. She had 13 degrees curve here, where it should be at 45, and within a few months, she went to 31 degrees. She's starting to get the banana back. The cool thing about her story is that this took a couple of months, but within the first week and a half of treatments in the office, she comes in with a big smile on her face, and she says, since our last adjustment, I have not had a migraine. I can feel my hands again. And ever since then, she hasn't had a migraine since. And I tell you this because, do you think this can happen in a week and a half or 2 weeks? And the answer is obviously no. For us to change the structure of the spine, there's muscles, ligaments, there's tendons that we have to retrain. Your symptoms might go away really soon. Your symptoms might be there for a while before they go away. But for us to rebuild the spine, it takes time, it takes effort. And I've seen severe cases up to 5 times a week for us to get these changes. Now here's the key. Once we see the changes, once we see a change in the spine, now we look at it and we say, okay, now we don't have to see you as often, but this is what happens in a lot of cases and in a lot of other chiropractors. If I get a change and I never see Jessica again, what do you think happens over time? Yeah, it goes back. So once we see a change, it is really simple. At that point, it's maintenance care. And maintenance care is simple. It could be as little as once a month for some people. In some severe cases, if there's a lot of degenerations, it could be as much as once a week. So fast forward, Jessica's been here over 4 years, and one of the things that I love about her case is that this wasn't just about her. As she got her health back, as she got off all her medications, she's been able to have 2 beautiful babies, and now this will have a generational impact on her family. So one last example here, and I love this example because this is Cozy Coleman. He won a Super Bowl with the Bucs, and he won an NCAA championship with Tennessee. Not too many people can say they have both rings. He does. I think it's pretty cool. And he became a good buddy of mine, and when he retired, he came to our office. He walks in and he filled out the paperwork and said, hey, I have sciatic pain. And if you don't know what that is, that's the pain that kind of goes down the back of your leg. So he came in, we did the exam, and this was his x-ray. This was his lower back. You can see the hips are here, and he had a huge curve in his lower back. So do you think that was putting pressure on the nerves going into his leg? Yes. This all made sense to Cozy. So he starts care, he goes through the process, the corrective care process, and this is his x-ray a year later. And you can obviously see the difference. Big curve, pretty straight spine here. Now the cool thing about his story is that about halfway through, at the 6th month mark, Cozy walks into our office and he looks at me and he says, could this be affecting my bowels? And I said, Cozy, the bottom half of your spine, what do those nerves go to? They go to your bowels. And he said, yeah, I know. And then he told me the full story. When he was with the Bucs and he would have his sciatic pain, they would give him the injections, they would give him pain meds, his pain chiropractic adjustments, 4 or 5, maybe 6 of those to get him out of pain. And it was medication for his bowels on top of medication on top of medication. And a couple of years later, they had to rush him into a surgery, and they did a surgery to take 1.5 foot of his bowels out. Put him on more medications. He's in our office, doesn't tell me anything about that. And about halfway through, he says, I'm not taking my medications for my bowels, and my bowels are doing better than ever. Could this be affecting my bowels? And this is when it clicked for him. This is when he understood that what we're doing here is not just about pain. This is much bigger than that. And from this point forward, his whole care plan changed. He brought his kids in, his whole family's under care, and now, years later, they're still under maintenance care, keeping their spine and nervous system healthy. And this is why our litmus test, it's not how you feel, it's not, is your pain going away? My litmus test, our litmus test in this office is, are these x-rays changing? Because if these x-rays are changing, we know you're getting healthier. So at this point, one of the doctors is gonna sit with you, we're gonna go over your x-rays, we're gonna give you your recommendations, your plan, your specific exercises, and at that point, you're gonna be able to decide, is this right for you? Is this right for your family? And if it's not, that is totally fine. We just want you to have all your information so you can make the best decisions for your health. Now, there is one thing I'm gonna ask. If you're a patient in this office, I think something that we're doing here is resonating with you. I'm going to ask you that as you move forward, just share the information you're learning here, share what you've learned about health, and the most important thing is that as you see success in this office, please share your success story with your friends, your neighbors, just like Jessica and Crazy Amy, so that they have a chance to see their health and their families transformed.